Hi, thanks for joining me for the General Orthopedic Coding Update for 2017. We have a new modifier in 2017 that represents telemedicine services. The definition is before you on the screen. The summary is it's real-time interaction between a physician or a qualified professional and a patient. And the services are to be documented just like an office visit or a hospital consultation. We would append this modifier to any of the applicable evaluation and management codes. What the modifier tells the carriers is that the service was rendered in the same format that you would render an office visit or a hospital consultation, but it was done through real-time interaction via something like Skype, and the provider documented all the services just like they would an E&M service. This 95 modifier can be applied to any new patient visit, established patient, any inpatient consultation, an inpatient visit, any office consultation. There's several more series of codes, but because we mostly work with specialty physicians where you're rendering services either in your office or an external facility, and it's professional services rendered by a specialist, an orthopedic surgeon, neurosurgeon, general surgeon, something of that sort. These are the codes that are applicable to your services. And so when it's done in a telemedicine environment, we would append the modifier to the same CPT code as if you saw the patient face-to-face, and it would notify the insurance carriers that that same E&M service was rendered in telemedicine capacity. The other area that is new for 2017 for general orthopedics is we have two new codes for closed treatment of a posterior pelvic ring fracture or dislocation of the ilium, sacral joint, or the sacrum. And the first code represents without manipulation. This is one of those confusing codes that really is almost an evaluation and management service where you carry a 90-day global period, and you, within that 90 days, are managing the routine healing of that closed fracture, even though it's only been braced. The second code is for the same treatment, only there's manipulation. And this code comes with a little bit of a requirement, and it's that it has to be moderate sedation or more than a local anesthetic. There are some new codes that somewhat tie into this. 99151 moderate sedation services have somewhat been recategorized or redefined. This is one of them, and it's moderate sedation provided by the same physician or same surgeon as providing the operative procedure. We have done a check, and the CCI edits do allow separate payment for this. I don't know if that's temporary, but as of right now, if you do provide moderate sedation for some type of fracture reduction, it does appear that right now you'll be paid separately for the sedation services, where in the past it was included in the services. So we don't know if this is a new direction, but for now you are paid separately, and we would bill it accordingly, and you would need to report this service in addition to whatever you're reporting for the procedure. That is it for general orthopedic codes. If you have any questions on anything that we presented here, please email me directly, josh@newportmed.com, or you can email the entire coding team at coding@newportmed.com. Thanks so much. Appreciate it.